Imagine a pig with just a slight limp. You might just think, oh, okay, sore leg, maybe bumped itself. Seems simple, right?
Right.
But what if I told you that simple issue, that little limp, is actually a window? A window into this astonishingly complex web involving genetics, nutrition, the environment, even a herd psychology.
It really is. What looks like a straightforward problem on the surface, well, it quickly unravels. It becomes this deep, interconnected challenge, so many factors involved.
Welcome, everyone, to a deep dive into porcine lameness. Today, our mission isn't just to talk about, a pig that's limping. It's to really understand this whole clinical syndrome. We've got a stack of comprehensive sources here, and we're going to pull out the key insights. The goal is to reveal a truly integrated approach for managing this complex challenge.
Yeah, it really requires that integrated view.
We want you to walk away understanding not just what causes it, but really why it matters so profoundly, and crucially, how we can actually prevent it.
Okay, so let's start with the basics. What is lameness? It's important to remember it's not one single disease. Right. It's a clinical sign. Basically, an abnormality in how the pig walks or stands. And it's always signaling an underlying issue. Could be pain, could be some sort of mechanical problem, bones, muscles, nerves, even the skin sometimes.
That distinction is so important. It's a sign, not the disease itself. And when you start digging into the biomechanics, some surprising things pop out.
Definitely.
Our research showed, for instance, that a sow's front limbs actually bear about 58% of her weight. So you would think, okay, front limb lameness must be easier to spot.
That's the intuitive thought, yeah.
But here's the twist. It's actually more physically demanding for her to lift a front foot, which means even a relatively mild limp in a hind limb is often more visually obvious.
That's a critical diagnostic clue right there, a real aha moment. For anyone observing pigs closely, you need to know what you're looking for.
Absolutely. And it goes way beyond just the limb, doesn't it? Once that pain and inflammation kick in.
Oh, absolutely. It transforms into this complex metabolic disease, this systemic inflammation. It actually changes how the pig uses amino acids.
How so?
Well, crucial nutrients, like lysine, which is vital for milk production, right? They get rerouted, diverted away from milk towards tissue repair somewhere else in the body, like making proline or phenylalanine.
Ah, so that explains why you might see a lame sow looking thin, in poor condition, even if she seems to be eating okay.
Exactly. Her body is just, well, it's partitioning those nutrients inefficiently. It's constantly fighting that inflammation, trying to repair damage.
So the body's own resources are kind of hijacked, and the consequences for the sow, they just keep stacking up, don't they?
They really do. This whole inflammatory cascade, it messes with hormonal balance too.
Which means
So impacts on fertility.
Yeah.
An increase in mummified fetuses, higher rates of stillborn piglets, even more piglets getting crushed, often because the sow herself is in pain. She's unstable in the farrowing crate. It's just a cascade.
Devastating cascade. And the economic hit, I imagine that's significant.
Oh, it's staggering. And it's way more than just the obvious things like vet bills or extra labor. The really big one, the major financial drain, is the cost of premature culling. Lameness is consistently one of the top reasons sows are involuntarily removed from the herd.
And they're removed earlier than other sows.
Much earlier. Sows culled for lameness leave at an average parity of just 2.6. Compare that to sows culled for other reasons, they usually stay for 4 parities, sometimes more.
Okay, 2.6 versus 4.0 or higher. Why is that specific number, that early removal, such a big deal economically?
Because a sow hits her peak productivity, her most profitable years, usually between her 3rd and 6th parities.
Ah, okay.
So if she's gone at parity 2.6, she's removed before she ever realizes her full genetic potential, her full economic potential. Often, the farm hasn't even recouped the initial cost of raising her.
Wow, so you lose the investment and the future profit.
Precisely. And then there's this other thing, kind of subtle but powerful, the empty crate effect.
Empty crate.
Yeah, when a sow is culled, her space, that farrowing crate or gestation spot, isn't immediately filled. So you get non-productive days, reduced facility use. It all adds up.
And that early culling, it must affect the whole herd structure too.
It does. It skews the herd towards younger animals, more first parity gilts. And younger herds generally mean poorer overall performance. Fewer pigs born alive, maybe lower weaning weights. It's a ripple effect.
And it doesn't stop with the breeding herd, does it? Growing pigs are affected too.
Absolutely. A lame growing pig, well, it's less mobile. It won't compete as well for feed and water.
So slower growth.
Lower daily gain, exactly. Increased days to market. Every stage feels the impact.
Even all the way to the processing plant.
Yep. Pathologies linked to lameness, things like arthritis or abscesses, they lead to carcass condemnations. Parts of the carcass, or sometimes the whole thing, might be rejected.
Do we have any numbers on that?
Yeah, there's a specific example from the UK. They estimated about 10 pence lost per finished pig due to these condemnations. It sounds small maybe, but scaled up. That's an industry-wide cost of up to £1.5 million a year, just from that.
Wow. So when you add everything together, the culling, the empty crates, the slower growth, the condemnations, what's the bottom line look like?
The overall financial loss is really significant. The sources give some estimates. Around €37 per lame sow in Germany. A study in the U.S. put it at $180 per lamb sow.
$180 per sow, that's huge.
It is. And a Dutch study found it cost €20 to €30 per sow present on the farm, averaged out. That really highlights the scale of this for you, the listener. It's not just a few pigs. It affects the whole system's profitability.
Okay, so it's a massive problem biologically and economically. How do we start to unpack what actually causes it?
Well, the absolute key thing to remember is that lameness is rarely caused by just one single factor.
Right, it's complex.
It's this intricate interplay between the pig itself, the host infectious agents, and the environment they live in. Often you have stressors, environmental, maybe nutritional, social stressors, acting as like predisposing factors or triggers.
They weaken the pig's defenses somehow.
Exactly. They compromise the pig, making it vulnerable, allowing these deeper problems to actually surface and cause clinical lameness.
Okay, that makes sense. So let's dive into some of those factors. Maybe start with the infectious causes. What are the main culprits there?
Sure. One group to know is Mycoplasma arthritis. There are primarily two species we worry about. Mycoplasma hyokinis, which usually hits younger pigs post-weaning.
Okay.
And then Mycoplasma hyosynoviae, which tends to affect older growers, finishers, and the adult breeding animals.
And what's unique about mycoplasma?
The really crucial thing biologically is that these bacteria lack a cell wall.
No cell wall. Why does that matter?
It matters hugely for treatment.
Yeah.
Because common antibiotics, like penicillin, work by attacking the bacterial cell wall. Since Mycoplasma doesn't have one,
Penicillin won't work.
exactly, they're inherently resistant. Mycoplasma hyosynoviae, the one in older pigs, often just hangs out asymptomatically in the tonsils. Clinical disease flares up when the pig is stressed, thinking mixing, transport, maybe a minor injury.
And what does that look like clinically?
Affected pigs are really reluctant to stand. They'll have a stiff gait. Sometimes you see this very characteristic dog-sitting posture.
Dog sitting.
Yeah, they sit back on their haunches, almost like a dog. It's their way of taking pressure off painful hind limb joints. It's not deadly, usually low mortality, but it can spread quickly. You can see morbidity hit like 50% in a group.
Half the group affected. Wow. Okay, who's next on the infectious list?
Erysipelathrix rhusiopathiae. Most people know it as swine erysipelas.
Ah, erysipelas. Heard of that one.
Yeah, it's surprisingly common. The bacterium is carried by lots of healthy pigs, and it's really tough, survives well in the environment. It can cause an acute form, the diamond skin disease with those classic skin lesions.
Right, that diamond shapes.
But for lameness, we're often more concerned with the chronic form.
Chronic erysipelas, what does that do?
It causes this severe, often permanent arthritis. You get these enlarged, stiff joints. Pigs might walk really stiffly, almost on their tiptoes. It can also cause problems in the heart, vegetative valvular endocarditis, which can sadly lead to sudden death.
So serious long-term consequences. Any other major bacteria?
Definitely Streptococcus suis. Strep suis is a big one. It's probably best known as the leading cause of meningitis in pigs, especially in the nursery phase, like 2 to 6 weeks after weaning.
Right, meningitis.
But it's also a very frequent cause of polyarthritis inflammation in multiple joints. And in newborn piglets, you can see something called joint ill, where the bacteria get in through maybe an unhealed navel or little skin scrapes.
Okay, so mycoplasma, erysipelas, strep suis, those are key bacteria. What about viruses?
Viruses are important to recognize too. The really big one, mainly for regulatory and trade reasons, is foot and mouth disease, FMD.
FMD, highly contagious.
Extremely contagious. Clinically, you see these painful blisters, vesicles on the feet, snout, mouth. But the really dramatic sign related to lameness is hoof sloughing.
Hoof sloughing, the whole hoof comes off.
The outer horn casing can separate and slough off. It's sometimes called thimbling. Causes severe widespread lameness. Obviously a huge animal welfare issue and triggers major disease control actions.
Understood. Any other viruses play a role?
Well, other viruses like PRSV, porcine reproductive and respiratory syndrome virus, they might not directly cause arthritis often, but they can cause significant immune suppression.
Ah, so they weaken the pig.
Exactly. They weaken the pig's defenses, basically opening the door for those secondary bacterial infections like strep suis or others to take hold and cause joint problems.
Okay, so that covers the main infectious players, but you said it's rarely just one thing. What about the non-infectious side?
Right, the non-infectious causes. These often form the sort of underlying foundation upon which lameness develops. A huge one in modern pig production is developmental orthopedic disease, specifically osteochondrosis or OCD.
Osteochondrosis, that sounds serious.
It is, and it's extremely common. Some people call it a disease of production
Why is that?
because it's linked directly to how we've selected pigs' intense genetic selection for really rapid growth and high lean muscle deposition.
Which is good for production efficiency, but
But it places immense biomechanical stress on the skeleton while it's still developing. It's almost an unintended side effect of breeding for performance.
so what actually happens in the bone or cartilage?
Essentially, the blood supply to the growing cartilage gets disrupted, and then the process where cartilage normally turns into bone fails. It doesn't happen correctly.
And this is widespread.
Shockingly so. Studies show that nearly all finishing pigs have some degree of these OC lesions, even if they don't show signs. They're subclinical.
So the damage is there, but hidden.
Often, yes.
Hmm.
Clinical lameness, the visible problem, usually gets triggered later, maybe by some kind of trauma, slipping on the floor, fighting during mixing.
Yeah.
Then you'll see the gradual onset of lameness, stiffness, sometimes a weird gait called goose stepping.
Goose stepping, okay.
Yeah.
What else on the non-infectious side? Nutrition must play a role.
Absolutely fundamental, especially minerals involved in bone formation.
Mm.
Calcium and phosphorus are the big ones, obviously. And vitamin D is needed to absorb them properly. It's not just about the amount, but the ratio between calcium and phosphorus.
Yeah.
The ideal K to P ratio is pretty specific, around 1.25 to 1, up to maybe 1.50 to 1.
And if that balance is off, or levels are too low,
If there are deficiencies, in young, growing pigs, you get rickets. The bones are soft, they can become deformed.
rickets, okay.
In mature animals, particularly lactating sows who are under huge metabolic pressure, deficiency leads to osteomalacia. The bones become weak, demineralized. They're prone to spontaneous fractures. You can even see sows go down with posterior paralysis.
Wow, just from a mineral imbalance, are there other nutrients involved?
Yes, definitely. Trace minerals like zinc, manganese, and copper are vital. And biotin, one of the B vitamins.
What do they do?
They're crucial for keratinization and overall hoof integrity. Think hoof horn quality.
Ah, so the hooves themselves.
Exactly. If pigs are deficient, you see poor hoof quality. Cracks in the hoof wall, separation at the white line, heel erosion. These aren't just cosmetic, they cause real pain.
Right.
In those cracks and lesions, they're open doors for bacteria to get in and cause infections.
Okay, so genetics, development, nutrition.
Hmm.
What about just straightforward injuries?
Trauma. Huge factor. Traumatic and environmental injuries. Claw and limb lesions are incredibly common, especially in sows. The data is pretty startling. Studies show 96% to almost 100% of sows have at least one claw lesion.
Nearly all of them.
Almost all. Even minor lesions cause pain, but severe ones are obviously a major cause of lameness.
And what's the main culprit behind these injuries?
The single most important environmental factor, the one that contributes most to these traumatic injuries, is the flooring.
The floor they walk on.
Yes. Inappropriate or poorly maintained flooring is a leading cause. It's a balancing act. Too rough, you get abrasions, scrapes. Too smooth, especially if it's wet, becomes slippery. That leads to slips, falls, sprains, even fractures.
What about slatted floors? They're common.
Slatted floors have their own specific risks. If the gaps between the slats are too wide, pigs can get their feet trapped. Ouch. If the edges of the slats are sharp or chipped, that causes cuts and bruises. Floor quality is just paramount.
Okay, flooring is huge. Anything else in the environment or management?
Definitely social and management stressors. Think about routine things we do. Weaning, transporting pigs, mixing unfamiliar groups together.
Those can be stressful times.
Very stressful. They often lead to intense aggression, fighting. And that results directly in wounds, bruises, sometimes even fractures.
And does that stress itself have other effects beyond the physical fighting?
Yes, and this is where it gets insidious. Chronic stress, the kind from constant fighting or poor handling or bad environments leads to the release of cortisol.
The stress hormone.
Right. And cortisol is immunosuppressive. It weakens the immune system.
Ah, linking back to the infections.
Exactly. It makes pigs more susceptible to those opportunistic bacteria we talked about. So you get this vicious cycle. Stress causes an initial injury or allows an infection. That lameness causes pain and immobility, which itself becomes a chronic stressor.
So the lameness feeds the stress, which makes the pig weaker.
And more likely to stay lame or get worse. It's a real downward spiral. Stress is a major, major player in the whole lameness complex.
Okay, that's a really comprehensive picture of the causes. Infectious, non-infectious, environmental, stress. It's all interwoven. So knowing all that, how do we approach diagnosis? It sounds like pinpointing the exact cause is crucial.
It absolutely is. A definitive diagnosis is fundamental. You can't treat effectively, and you certainly can't prevent effectively if you don't know what you're dealing with.
So where do you start? On the farm, presumably.
Right, on-farm clinical assessment. And it begins with taking a really good history.
What kind of information?
Age of the pigs affected, how many are affected, the morbidity rate, any deaths, how long have the signs been going on, have there been any recent changes, new feed, new group mixing, anything like that.
Okay, gather the background.
And look at the records, production data, culling rates, reasons for culling, any feedback from the processing plant about carcass condemnations. That objective data can tell you if this is just one or two pigs, or if you have a bigger herd-level issue brewing.
Makes sense. What about actually looking at the pigs?
Visual lameness scoring. Using a standardized system, like the Zinpro 0 to 3 scale, for example, it's invaluable.
How does that help?
It helps with early detection, catching problems before they get severe. It lets you quantify the prevalence, how widespread is it, and you can use it to monitor if your interventions are working. But, and this is important,
Yes.
pigs are prey animals. They have a very strong natural instinct to mask pain and weakness.
So they might look okay even if they're not.
They'll try to. So you can't just glance at them. You need active, careful observation. Watch them walk, watch them get up and down. Look for subtle signs.
Active observation. Got it. Is technology helping here?
Oh, definitely. This is where things are getting really exciting. Advanced on-farm tech, like microcomputer-based embedded force plate systems.
Force plates.
In the feeders. Yeah, often integrated into electronic cell feeders.
Yeah.
These plates measure the weight distribution on each leg multiple times a second, every time the sow stands there.
And they can detect lameness.
They can detect the subtle shifts in weight bearing that indicate lameness, often long before we can see it visually. On average, these systems can pick it up about 4.6 days earlier than even a trained person watching closely.
Nearly 5 days earlier. That's huge.
It's a potential game changer.
Yeah.
Because it means you can intervene much earlier. When the condition is less severe, treatment is more likely to work, and the prognosis for recovery is drastically better.
Wow. Early detection through technology. Okay, so that's on farm. What about more advanced diagnostics if you need to dig deeper?
Post-mortem examination, or necropsy, is often the most valuable tool, especially if you can examine pigs that are acutely affected and haven't been treated yet.
What are you looking for in a necropsy?
You examine everything systematically, joints looking for swelling, fluid, damage to the cartilage, bones, fractures, signs of infection, developmental issues like OCD, the spine, but also other organs because sometimes lameness is a sign of a systemic disease, like erysipelas affecting the heart valves.
Okay. Does the necropsy always match the clinical signs?
That's a really interesting point from the research. There's often a significant disconnect.
A disconnect. How?
Well, you might find pigs at slaughter with quite severe osteochondrosis lesions in their joints, but they never showed any obvious lameness during their life. They were subclinically affected.
Okay.
And conversely, sometimes you have a pig that was severely lame, but when you do the necropsy, the visible lesions in the joints seem minimal. Pain doesn't always correlate perfectly with visible damage.
So what's the real value of necropsy then, if there's this disconnect?
The true strategic value is in establishing a definitive diagnosis in a few representative animals from the affected group.
Representative animals.
Yes. You use those findings to infer what's likely causing the problem at the herd level. It allows you to shift from just reacting to individual sick pigs to implementing proactive management strategies for the whole population based on a confirmed diagnosis.
That makes sense. Using individuals to inform the group strategy. What about imaging? Like X-rays?
Yep. Diagnostic imaging is very useful. X-rays are great for seeing fractures, obviously. Also, bone infections, osteomyelitis, or signs of rickets or OCD. More advanced stuff like DECT scans or MRI is used more in research right now, helping visualize subtle early changes like bone edema before major damage occurs.
And lab tests, blood work, cultures.
Essential microbiology trying to culture bacteria like erysipelas or strep suis from joint fluid or tissues. If you can identify the bug and know its antibiotic sensitivity, you can choose the most effective treatment.
Right, targeted treatment.
But some bacteria are tricky. Mycoplasma, remember. Difficult to culture because they lack that cell wall and are quite fragile.
So how do you test for Mycoplasma arthritis?
Molecular diagnostics. PCR tests are the test of choice. They detect the specific genetic material of the mycoplasma, even if you can't grow it.
PCR, okay.
Histopathology is also important, examining tissue samples under a microscope to confirm inflammation or degenerative conditions like OCD at a cellular level. And then there's a promising area, measuring acute phase proteins, APPs.
The acute phase proteins, what are those?
They're proteins in the blood whose levels spike very quickly in response to inflammation or infection. Things like C-reactive protein or PIG-MA. Measuring these can be a rapid, minimally invasive way to objectively tell if an animal has active inflammation even before obvious signs, and maybe track how severe it is.
Okay, lots of diagnostic tools. So let's say we have a diagnosis. Now we need to talk about management, both treatment for the sick ones and prevention for the rest.
Exactly. Integrated management. And for treatment, the absolute golden rule, based on everything we've discussed, is early treatment is critical.
The sooner the better.
Without a doubt. The longer you wait, the more damage occurs, the harder it is to resolve. For bacterial infections, if we know what we're dealing with, we use targeted antimicrobials.
Like for erysipelas.
Penicillin is the drug of choice, works very well, but you must complete the full course of treatment to prevent it from becoming that chronic joint-damaging form.
Okay. And mycoplasma. We know penicillin won't work.
Correct. For mycoplasmal arthritis, you need different drugs. Things like tamulin, lincomycin, or tetracyclines are commonly used, ones that don't target the cell wall.
And strep suis.
Cranicillin or amoxicillin are usually the first line. Good effectiveness generally, but it's worth noting with strep suis, there's quite widespread resistance to tetracyclines now, so susceptibility testing can be important if first line fails.
All right, so antibiotics for the specific bugs. What about managing the pain and inflammation itself, regardless of the cause?
Absolutely essential. Anti-inflammatory and analgesic therapy, usually NSAIDs, non-steroidal anti-inflammatory drugs, should be a standard part of treating any lame pig.
Why is pain relief so critical?
Think about it. A pig in significant pain won't want to get up. It won't eat properly, won't drink enough, won't move around.
Which hinders recovery.
Severely. It stops them from getting the nutrition and hydration they need, and movement itself can be important for joint health in some cases. So, managing pain with drugs like flunixin meglumin or meloxicam is crucial for their welfare and for the success of any other treatment. Quick caution though, NSAIDs can have side effects, like potential gut irritation, so correct dosage and duration are important.
Okay, medication is one part. What about supportive care? The environment for the sick pig?
Equally important. The very first step, immediately when you identify a lame pig, is to move it. Remove it from the main group and put it into a well-managed hospital pen.
Why is that separation so critical?
Several reasons. It protects the lame pig from bullying and aggression from healthier pen mates. It ensures it has easy, unimpeded access to feed and water without competition. It provides a more comfortable environment, and it allows for closer observation and easier treatment by staff.
Makes sense. What does a good hospital pen look like?
It needs to be clean, dry, warm, and definitely free from drafts. Flooring is key here too. Ideally, deep bedding, like straw. That provides comfort and cushioning. If it's slatted flooring, using rubber mats can make a big difference.
Okay, comfortable flooring. What else?
Easy access to resources. Feed and water should be close together, ideally within a meter so the pig doesn't have to walk far. For severely compromised animals, maybe use bowl drinkers instead of nipple drinkers, as they can be easier to use. And stocking density needs to be low. Keep group sizes small, maybe no more than 5 or 6 pigs, and provide ample space like 3 square meters per sow. It's not just a holding pen, it's a recovery environment.
You mentioned observation. Does having these pigs grouped together help in other ways?
Yes, absolutely. The hospital pen isn't just a sick bay, it's also a fantastic surveillance tool for the whole farm's health.
How so?
By concentrating the problem animals in one place, you get a really efficient way to assess what challenges the farm is facing. You can observe patterns in the clinical signs, you can see how different groups respond to treatments.
Give me an example.
Okay, say you move several lame pigs to the hospital pen. You treat them with penicillin, and they show a rapid, dramatic improvement.
Uh-huh. Suggests erysipelas.
Exactly. That observation provides invaluable data. It strongly suggests erysipelas might be circulating, which might prompt you to say, give booster vaccinations to the main breeding herd to prevent a bigger outbreak.
Using the hospital pen data for herd-level decisions?
Wow.
Clever.
And of course, part of good hospital pen management is knowing when treatment isn't working. Having clear protocols for humane euthanasia, clear stopping rules, is a crucial aspect of responsible animal care to prevent prolonged suffering.
Absolutely. Okay, that covers treatment and care for the affected individuals. Now, the big one, prevention. Shifting to being proactive.
This is where the real gains are made. The research, the evidence, it all points towards moving away from just reacting towards a proactive, integrated, multifactorial strategy, looking at genetics, nutrition, environment, herd, health, everything together.
Building resilience into the system. Where do you start? Genetics.
Genetics and conformation selection are foundational. Feet and leg soundness, structural correctness. These traits are moderately heritable.
Moderately heritable, meaning selection works.
Yes. Consistent selection pressure for good feet and legs, generation after generation, leads to significant improvement over time.
What specific traits are you looking for?
Things like proper leg angulation. You want to avoid pigs that are too straight-legged, sometimes called post-legged because they lack shock absorption. You want good slope to the pasterns. Large feet with even-sized toes that are placed squarely, a long, level top line. There are standardized scoring systems to help evaluate these traits objectively.
And the implication is?
Cull animals that don't meet the minimum structural standards. Don't breed problems into the next generation. Start with a good foundation.
Okay, genetics first, then nutrition. We touched on minerals.
Yes, nutritional management specifically for skeletal health is the next pillar. Reinforce the calcium and phosphorus, not just the levels, but that critical KP ratio, 1.25.1 to 1.50.1, and adequate vitamin D for absorption.
And the trace minerals and biotin for hoof health.
Crucial. Zinc, manganese, copper, biotin. They're vital cofactors for making healthy cartilage, connective tissue, and that strong hoof horn. And there's interesting research showing that using organic chelated forms of trace minerals compared to inorganic forms can significantly reduce the number and severity of claw lesions.
Organic forms are better absorbed or utilized.
That's the idea. Better bioavailability. And biotin supplementation is well known for helping produce harder, more durable hooves, less prone to cracking and wear.
Got it. Genetics, nutrition, back to the environment. Flooring again.
Flooring. It just keeps coming up because it's arguably the leader in causing traumatic injuries. You need that balance: hygiene, durability, comfort, safety.
What's the ideal, if possible?
Solid floors with generous bedding, like straw, are often considered the gold standard for comfort and reducing impact. But they have hygiene challenges.
Right, so for slatted floors, which are common for hygiene.
For slats, the design details are absolutely critical. Things like the width of the slat itself and the width of the gap between slats. There are specific recommendations, like in the sources, Table 4 gives examples for sows, maybe 105 millimeter, or about 4 inches, slat width, and a gap of 19 millimeters, less than an inch, is considered optimal. Edges must be smooth and rounded, no sharp bits. Get these details wrong, and you invite injuries.
Precision matters. What about space? Stocking density?
Overcrowding is a major stressor. It increases aggression, competition, and the risk of injury. Providing adequate space per pig is vital. For example, aiming for at least 1.1 square meters, maybe 12 square feet, per gilt in group housing.
And anything else in the pen design? Enrichment.
Environmental enrichment is surprisingly important for lameness prevention. Providing things pigs can manipulate: straw, ropes, pieces of wood.
Why does that help prevent lameness? Seems indirect.
It gives them an outlet for their natural exploratory behaviors. It reduces boredom, frustration, and chronic stress. Less stress means less fighting, less injurious behaviors like tail biting or aggression. It also tends to make pigs calmer and easier to handle.
Reducing stress skin. Okay. Last piece of the prevention puzzle. Overall herd health management.
Yes. Starts with robust biosecurity. That's your first line of defense against bringing infectious pathogens onto the farm in the first place. Controlling who and what comes onto the site, quarantine for new animals, strict cleaning and disinfection protocols. Basic, but essential.
And vaccination.
Vaccination is a very effective tool for certain diseases. Erysipelophix, Rusupathia, erysipelas is a great example. The vaccines provide excellent protection. Regular boosters for the breeding herd, maybe every 6 months or before farrowing, are standard practice.
What about strep Cs? You said that was complicated.
It is, because there are so many different strains, or serotypes. Commercial vaccines don't cover all of them. Sometimes farms use autogenous vaccines, custom-made from the specific strains found on that particular farm, but their effectiveness can be variable.
Okay. And handling the pigs.
How pigs are handled day to day is vital. Low-stress handling techniques are crucial to prevent stress and traumatic injuries during movement. Training staff to understand the pig's flight zone and point of balance. Using handling aids properly. Minimizing or ideally eliminating the use of electric trods. Calm handling makes a huge difference.
So putting it all together, genetics, nutrition, environment, health protocols, handling, it's a lot. Is there one area that's maybe the most critical point for prevention?
If you had to pick one phase where you get the biggest bang for your buck in prevention, our sources really underscore the gilt development phase.
Raising the young replacement females.
Exactly.
Yeah.
This period, from selection through to their first breeding, is the single most critical control point. This is where genetics meets nutrition meets the environment, where they adapt and grow strong skeletons. A failure here, poor nutrition, bad flooring, stressful mixing during development, creates these latent weaknesses, problems that might not show up immediately but will absolutely manifest later, leading to premature culling.
So investing heavily in getting gilt development right.
Provides the highest long-term return on investment for preventing lameness and ensuring longevity and productivity. It sets the foundation for their entire productive life.
Okay, so let's try to synthesize the key findings from this deep dive for you, the listener. What have we learned?
I think the main takeaway is that porcine lameness isn't just a simple sore leg. It's this pervasive, economically damaging syndrome. And it has a complex, multifactorial cause, rarely just one thing.
And because of that complexity, a purely reactive approach, just treating sick animals as they pop up, it's just not sustainable, is it?
Not at all. The evidence we've looked at overwhelmingly supports shifting to a proactive, integrated, systems-based approach, focusing on prevention across the entire production cycle: genetics, nutrition, environment, health.
Looking ahead then, what does the future hold? Where is the industry heading in tackling this?
Well, we already touched on the automated early detection systems, the force plates, but also things like 3D cameras, accelerometers worn by the pigs, coupled with machine learning and AI. The potential is there for continuous objective monitoring of gait and behavior, detecting those subtle problems even earlier than force plates, perhaps.
Catching it before it even starts, almost. What about genetics?
Moving beyond just looking at the pig, the visual scoring, towards genomic selection for soundness, identifying specific genetic markers, QTLs, SNPs that are linked to better structural traits or maybe resistance to developmental diseases like OCD. Breeding based on the DNA blueprint.
And treatment. Any advances there?
There's ongoing research into novel therapeutics, looking for longer-acting, safer pain relief options, better anti-inflammatories, maybe even exploring things like regenerative medicine, stem cell treatments, for instance, for particularly high-value breeding animals with joint issues.
Interesting. Anything else on the horizon?
One area gaining traction is understanding the role of the microbiome, the communities of bacteria in the gut and respiratory tract, and how they influence the pig's overall immune function. This could lead to new strategies like novel probiotics or feed additives designed to modulate the immune system or prevent pathogens from spreading systemically from the gut or tonsils, building resilience from the inside out.
Fascinating stuff. So after drilling down this deep into porcine lameness, here's a final thought for you to ponder.
How should we really frame lameness prevention? Maybe not as just another operational cost, another expense line on the farm budget.
But instead,
View it as an essential investment. An investment in the future productivity, the longevity, and the fundamental well-being of the entire herd. It's about building healthier, more robust animals, which leads to more sustainable production systems, and ultimately, yes, improved profitability. What does this deep dive make you think about the hidden connections behind seemingly simple problems on the farm?